So, like Jen said, we are going to be talking about subclinical mastitis and dry-off decision-making in dairy goats today. If you have questions about this webinar, feel free to email them to me directly at mpbuck@iastate.edu. My boss is Dr. Patrick Gordon. He's not with us today, but if you have questions that you think should be handled specifically by him, his email address is at the bottom as well. So just a little bit of a introduction for you. There is a brief quiz, but you're not actually getting graded on it. I just am looking for some background information. Then we're going to talk about the different types of mastitis, monitoring udder health, and then intervention strategies, ensuring food safety, and then we are going to finish up with a little bit of question and answer. So Jen, if you want to queue up the survey now. My first question is, how many participants currently utilize some form of mastitis screening on their dairies? So are you using a California mastitis test, DHI? Do you do DHI tests regularly? Do you utilize cultures at any point? Second question is, do you utilize some kind of dry therapy on your goats? Yes or no? That could include targeted dry therapy, meaning you only treat goats that you believe are at high risk for developing an infection during the dry period, or do you just not use antibiotics on your goats at dry off at all? And then the third question is relating to testing milk once goats have freshened. If you have used dry therapy, are you testing that milk before you put those animals back in the milking stream? So if you could take a minute.
Can see those responses there, Michelle?
Yes, I can. So we do have some screening that's happening on farms. A pretty even spread. CMT seems to be the most common. We're about 50-50 on the dry therapy use. And then only 23% are testing milk before it goes into the bulk tank, and 77 are not. So awesome. Looks like this is a great audience to be talking to on this subject today. So let's see here. Okay. So first I want to talk about clinical mastitis so that we can differentiate that from our subclinical, which is what we're going to be focusing most of the presentation on today. So clinical mastitis is something you're going to see when you go through and milk your goats every day. Signs that you might notice include heat around the mammary gland, swelling, pain, redness, abnormal milk. Goat might try and kick you when you're milking her because she's so uncomfortable, and that milk is going to clearly look different. So you can see here, this first picture is a bunch of different examples of mastitic milk. So it could just have some flakes in it. It might be clumpy, all the way to discolored red, red or brown, and like clearly abnormal milk. Causes of clinical mastitis, the most common causes are going to be broken up into two groups. So we can either have contagious causes, which would include Staph aureus, Mycoplasma, or other staph species, and then environmental, which are things that your goats are going to pick up from the environment, like E. coli or Trupperella. I also want to make sure that we don't forget there are other causes besides bacterial causes, like viral, like caprine arthritis encephalitis virus, or ovine pneumonia can also, OPP can also cause an arthritis. The focus of this presentation is on the more common causes, which are bacterial. And these are also the ones that we're going to be able to address easily with intramammary antibiotics. So just don't forget that there are other causes besides bacteria that can cause mastitis. So when we see a case of clinical mastitis, the recommendation is always going to be to culture that. So we want to do the culture so that we can identify what the cause is. And then based on that, we'll know, is this something that may be susceptible to our antimicrobial therapies? Which antimicrobial therapy should we utilize? Or is this something that's not likely to be susceptible to our antimicrobials? And do we need to pursue another route of management, such as creating a separate milking string in the case of the contagious like Staph aureus goats, or if maybe it's just best for us to cull this goat from the herd before she starts affecting everybody else. Excuse me. So I'd like to juxtapose clinical mastitis with subclinical mastitis, which is mastitis that you're not going to see. So they have an infection in the mammary gland. There's a bacteria or a virus that is living in that tissue that doesn't belong there, but it's not causing outward clinical signs necessarily. Things that we might notice that will allow us to detect this would be a mild to moderate elevation in our somatic cell count. We might see decreased milk production in subsequent lactations if this infection is allowed to go on for a long period of time and cause more chronic damage to the mammary tissue. Excuse me. We can also see asymmetrical formation of the udder after freshening. So I've heard a lot of producers complain, oh, my goat's freshen in, they have, an asymmetrical udder, one side's much bigger than the other, but there doesn't seem to be any active signs of inflammation. And a lot of times what we'll find when we culture those does is that they're positive for coagulase negative staph in the smaller side of the udder. And so that bacterial infection has kind of sat there and damaged enough of the mammary tissue to where she's not producing as much milk on that smaller side. We could have some subclinical Staph aureus infections as well. And I think a lot of the subclinical Staph aureus infections are kind of our, excuse me, typhoid Marys, pun intended with my coughing, where these are the goats that are kind of sitting in the herd. They're not showing obvious clinical signs that they have an infection, but they're harboring this bacteria. And if we're not really, really careful with our cleanliness during milking, these are the goats that are going to spread the Staph aureus infection to the rest of our herd. So that's kind of the difference between clinical and then subclinical mastitis. So if we can't see outward signs of subclinical mastitis, then what is going to be the best way for us to detect this problem before it becomes a chronic issue? The first option is going to be to do a culture. So some herds will culture their animals at a certain point during the lactation or before they're going to dry off animals so that they can get an idea of prevalence of which pathogens are going on. Are common in their herd. And you can also decide, if you have a Staph aureus animal that's being sneaky and not showing clinical signs, this would be an opportunity for you to identify that animal or those animals and manage them appropriately. Culturing also allows for targeted dry therapy. So we can identify does that do have a subclinical infection with a bacteria that doesn't belong in their mammary gland. And then we can target them with antimicrobials that are going to hang out in their udder during the dry period. And we'll have plenty of time to really dig in and get rid of the bacteria that are causing the infection so that when she starts her new lactation, she's ready to rock and roll. This is definitely a more costly option compared to some of the other things that we'll talk about. So that's going to be our biggest downside to culturing. Certainly, we want to make sure that these samples are being handled by labs that are familiar with milk cultures. So not just any diagnostic lab is going to be necessarily familiar with the different pathogens that we see in milk. So I always recommend submitting these to a milk quality diagnostic lab. Or there is an option for in-house culturing with the University of Minnesota Easy Culture System. That's definitely something that is doable with producers, but it's something you should really work with your veterinarian on. It's not just something where you send out for it in the mail and you're ready to go the minute that you get it. It does take some training, and identifying different bacterial species can be a bit of a challenge. So I would say definitely encourage people to pursue that option if you think it's best for your setup, but don't exclude your veterinarian from those decisions and from the training that's going to come with it. Excuse me. So at this time, what a lot of herds are doing is sampling all the does 1 week prior to dry off in order to identify those does and get the culture results and turn around before you're ready to dry them off. So 7 to 10 days is going to give you an appropriate window for that. We are especially interested in Staph aureus and Mycoplasma animals because we want to separate those out into a different milking string or maybe make some culling decisions there. It's also important to request identification of all non-aureus Staphylococci species because a lot of milk quality labs that are used to dealing with bovine milk samples are just going to report those as coagulase negative staph or non-aureus staph species, when really we want to know what kind of species they are or what kind of Staphylococcus they are. And some of them will just not even report them as Staphylococcus. So it's important to make sure that you're requesting that you would like those to be identified specifically. Excuse me. Collecting cultures can also be a bit tricky, making sure that we are getting aseptic culture and we're not getting contamination from the environment is imperative. We want to make sure that we're not wasting these cultures by contaminating them. So this is another place where working with your veterinarian on how to collect those samples appropriately is going to be really important, but it does definitely take a little bit more time and labor than just going through your normal milking routine. Our next option for screening for subclinical mastitis is going to be the California mastitis test. And if you have worked with any bovine dairies, then you're going to be really familiar with this option. So essentially what this is there's a little paddle with 4 different circles on it because it's made for cows. But can easily be utilized for goats as well. You're going to milk squirt a little bit of milk into individual paddles for each half of the doe's udder. And then you're going to add a reagent to that. And there's specific instructions that come with the California mastitis test, the test kit that you should make sure to read and follow before you start that process. But again, we like to evaluate does around the time of dry off. This can also be done throughout lactation to evaluate any subclinical infections that have started up during lactation, and it's a much less cost-intensive option. It definitely does take a little bit of time, though not as much probably as collecting cultures, but this is something that producers find a lot more easy to utilize throughout lactation to screen their animals. So if you're going to utilize the CMT option, I would recommend at least culturing your bulk tank fairly regularly to screen for contagious pathogens, especially if we're seeing issues with elevated somatic cell counts in the herd, or if you're just, working on getting your cell count down. Checking the bulk tank, making sure that we're not seeing Staph aureus or Mycoplasma in the bulk tank. That's going to mitigate a lot of concerns about those bigger, nastier, contagious pathogens. So when we're using the California mastitis test, we're going to use the scoring system. So negative, trace, weak positive, distinct positive, strong positive. If you're seeing a strong positive, a lot of times those are going to be your clinical dose. So you may not even notice, you may not even have a lot of 3s or strong positives when you go through and test your herd, unless you're seeing clinical signs that that doe has an infection in her mammary gland. And a lot of farms are going to vary on when they initiate treatment. So if certain farms may have, may say, oh, she's a trace, well, we're just going to watch her. We're not concerned that she has a severe infection. This might just be, a little bit of something that her immune system can kick on its own. We don't feel that it's appropriate to use antibiotics in that animal. Some farms may say, oh, anything that has any indication of an infection at all, trace or higher, we're going to be treating those. So again, this is something where the decision-making is a farm-by-farm basis and should be a conversation with the producer and the veterinarian. So the third option for screening for subclinical infections is going to be DHI testing and utilizing the somatic cell counts on your animals. to detect deviations in the health of their mammary gland. So these tests are assuming that somatic cell count directly correlates with an infection in the mammary gland, and meaning that the higher the count, the more likely there is an infection, or the more severe the infection. I would make the caveat that, as most of us know, there is, or maybe we don't know, there's a tendency in goats, especially, to have a seasonality to their somatic cell shedding within their mammary glands. So even if they're perfectly healthy, you're very likely going to see higher somatic cell counts during the fall and winter months than you would during the spring and summer months. And also, as a goat moves further into her lactation, she's going to shed more somatic cells than she did at the beginning of her lactation. So it's important that we're not just looking at one time point when we are evaluating somatic cell counts, because you might see that a doe has a pretty high count, but if you look at her through her entire lactation, it might just be a pretty steady slope of that curve. However, another doe might have a really low somatic cell count when she starts her lactation, and then she jumps up a couple thousand points rapidly in the next test. That's a doe that we're probably going to want to be concerned about, and dig a little deeper with probably some culturing on her to evaluate the health status of her udder. Excuse me. So DHI testing is something that needs to be sent out to a lab once you collect the milk sample. This is something a producer can collect, or you can have a technician come out and collect samples from your herd. It's, not necessarily the most economical option for a smaller scale operation, but for larger operations, excuse me, these technicians are pretty quick at their job, and they might make your life a lot easier. So you can also get information about components. So protein, fat, milk urea, nitrogen, excuse me. This information is all included in DHI tests as well as the potential for bioprint pregnancy testing. So that there are some different options that might make doing this testing a little bit more worth your while, if you're able to add in a couple of different services. Like I said, this is helpful in that it's giving us year-long data. You're going to be doing this testing at regular intervals, most likely, especially if you're on the American Dairy Goat Association Herd Improvement Program. That requires a certain number of tests throughout a 12-month period. And so getting that regular data is going to help us to track trends and notice when there's changes in those trends. Just a quick note, this does tend to slow the milking process a bit as well. Most of these different options will, but it can throw the goats off to have a strange person like a DHI tester come in the parlor once a month. I know there are some dairies where they say that the goats get all out of sorts when there's someone new and there's a new routine. So just something to make note of, that those are a few things you might be dealing with. It is also important to note that even though you are taking a milk sample and sending it to the lab, it's not a culture, and you will not be getting any pathogen data from DHI tests. So, all right, I'm going to take a break for a drink, and now let's talk about some options for Dryoff therapy. So Dryoff therapy that I'm talking about today is antimicrobials, and specifically intramammary antimicrobials. There are several products on the market that are approved for use in dairy cattle, but none are approved for use in dairy goats. And we're going to talk about that a little bit later, but that's the specific therapy that I'm talking about today. And the goal of utilizing that therapy is going to be to mitigate subclinical intramammary infections during the dry period. So our first option, of course, is to do nothing. You don't have to utilize dry therapy. If you are on an organic operation, then that would not be an approved course of action. There's no antibiotics allowed or there's a lot of restrictions on which drugs can be used on organic operations in general. And I don't claim to be an expert on that, but I do know that intramammary antibiotics are a no-no. So this isn't going to be for everyone. It also doesn't require any extra management to not treat your animals. If you are going to use antibiotics, there is a bit more management involved. And so if that's not the type of operation that you run and you just go out and milk your goats every day and you don't want any more hassle, then probably not the type of setup where we're going to be ready to implement dry therapy. It can certainly be done, but there will be other changes that need to be made other than just infusing your goat's udders with an antibiotic when you dry them off. Excuse me. And of course, there's no additional cost because we're not using antimicrobials, which do come with some expense. The downside, as I think you've probably understood, if I've done my job correctly up to this point, is that we have a pretty significant risk of residual subclinical infections if we're not evaluating these animals and we're not treating them. And there's also a higher risk of new infections forming during the dry period. So the next option is going to be blanket dry therapy, where we're just treating everybody in the herd, regardless of their infection status. So the upside is you don't necessarily need to do any of that pre-dry monitoring that we've talked about in the first part of this presentation, but we'll still be able to mitigate susceptible infections if our does have any. And we can also potentially prevent new infections of antimicrobial or of bacteria that are susceptible to these products. These antibiotics are going to stay in the mammary gland for a lot longer than the lactating antibiotics that you might use in a milking animal. And so we might see some carryover there. The downside is that there's definitely more intensive management required than not treating your animals at all. We need to know breeding date and expected dry period length so that we can ensure that these animals are going to be not milked or going to be dry for long enough that this antibiotic will remain in the udder long enough to do its job and also to avoid residues once the animal gets milked again. We also are probably going to want to do some post-fresh residue monitoring after they do kid out, just to make sure that we don't have any evidence of residues going into our bulk tank, just to be extra careful. We always follow our withdrawal periods, of course, but it's always best to do a little bit of monitoring on the back end as well. Excuse me. And I'll get into that a little bit later in the presentation. And the last downside is that there's a cost of dumped milk post-freshening if your animals do show residues before once they kid. So hypothetically, this milk could be pasteurized and fed to kids, but a lot of farms aren't necessarily set up to handle that type of management. But there's a lot of different factors that go into this decision, basically. So, excuse me. So you'll see this little picture here. Basically, all the goats are going to get treated with intramammary dry products, as opposed to our third option, which is called targeted dry therapy, where we are utilizing health data to determine which does receive treatment. So you see the little graphic here. We've cultured all of these does, or we've done a somatic cell count or mastitis test on everyone, and we've decided that this one doe here is at the highest risk for developing or for having an infection currently. And so we're going to treat her and only her with an antimicrobial, and we're going to not treat any of those other does. We might also consider treating does with a history of multiple episodes of mastitis in a previous lactation. And there are some other criteria that might incline us to include a doe in our dry therapy program. So this is an individual farm decision, and again, a discussion that needs to be had with the producer and your veterinarian so that you can make the best decision for which does to include in your program. Upside, this is our most judicious use of antimicrobials, which is really the focus of my research and all food animal veterinarians' major concern for us is we want to make sure that we're not using antimicrobial drugs inappropriately. And so by targeting animals that are high risk for having an infection, and more specifically an infection that we know is going to be susceptible to an antimicrobial that we're able to use intramammary, then we can avoid excess use, which is going to save the producer money in the long term. So there's kind of two upsides that are very much connected there. The downside, this is going to require the most management. We need to be evaluating these does in a timely manner around freshening or around dry off, I'm sorry. And we need to make sure that we are separating treated does and untreated does so that we're not confusing who can just go straight into the bulk tank and who needs to be tested before they can start getting milked into the tank again. So I just wanted to make a note on this milk testing that I keep mentioning. This is, again, you might notice the theme. This is something where producers and veterinarians need to work together, and you can include your milk processor in this discussion as well. There are a couple of different options for goat side tests that can be used to detect antibiotics. And the decision for which tests to use is going to depend on what your processor recommends, and also which antimicrobial you're using on farm, because not all of these tests detect the same drugs. So a couple of common options are going to be the Delvo test, which takes a couple of hours to run, but it's pretty effective in goat milk. And then the Charm EZ system, the SLBL test is approved for detecting several different beta-lactam antibiotics in goat's milk specifically. Excuse me. But it doesn't detect all of the antibiotics that we can use for intramammary treatment. So, so it's important that we're taking all of these things into consideration before we decide which tests to employ on farm. It's also important to remember that goat side tests or cow side tests are meant for bulk tank sampling and not individual animal sampling. They can be used on individual animals, but the way that we interpret that data is going to be a little bit different. So this is something to discuss with your veterinarian, or again, you can email myself or Dr. Gordon if you have more questions about how to sample a bulk tank and what recommendations to use for individual animal sampling. So, but I didn't want to leave people in the dark on this mysterious testing that we're talking about here. So the last portion of my presentation, I just want to talk to you guys about the current research that I'm undertaking that kind of encompasses everything that we've talked about so far. And the goal is to improve antibiotic stewardship in dairy goats to assure milk quality and food safety. Because the lower the somatic cell count, the healthier the goat's udder, the better quality milk that we're producing. And so we want to make sure that our main goal is keeping that udder healthy and minimizing the amount of antimicrobials that we need to use to do so. So maybe it wants to go to the next slide. There we go. Okay, so the goals of this project, there are 4 different categories that we're working on executing. So the first portion of the project is determining meat and milk residue data for 2 different dry cow products. So we are comparing, we're using Orbenin DC, which is cloxacillin, and Tomorrow, which is cefepyrin. These are intramammary antimicrobial, long-acting antimicrobials that we are currently using in dairy cattle on label, but they are not currently labeled for dairy goats, and we don't really have any information about how long these drugs stay in the meat and milk of goats. And so my first task was to get that information, and we'll be compiling that data in the next couple of months and submitting it to FARAD, the Food Animal Residue Avoidance Database, who's going to use it to recommend withdrawal times that are more appropriate, excuse me, for goats and not just extrapolated from dairy cattle. So that's exciting for nerds like me who like that kind of thing. The next portion that I'm currently working on is evaluating the efficacy of these dry cow products on coagulase negative staph species specifically. My goodness. That project is, like I said, currently underway. We are doing part of that project here, actually in Wisconsin, and then another subset of animals are being evaluated out in California with Dr. Rosie Bush out there. So essentially what we're doing is culturing does the week before they're due to dry off. Any that are positive with coag negative staph, we are targeting and treating those halves of the udder that are affected with the bacteria, and we're treating that with an assigned antimicrobial, one of the two that we're evaluating, and then we're culturing them again after they freshen and trying to see how effective were these antimicrobials at curing these infections. Because we know they're effective in cattle, but in goats, again, we just don't have that data. So one thing that I've found interesting so far, since we finished culturing our Dryoff, we finished our Dryoff cultures, is that we are seeing about a 40% prevalence of intramammary infections in the particular dairy that we're working on. Excuse me. And I would say probably 90% or greater of those infections are coag negative staph. So this is a very, very common pathogen in does that are not showing clinical signs of mastitis. We're also evaluating the correlation between somatic cell count and infection status, because like I said, there are a lot of things that can affect somatic cell count increases in goats. It's not just a direct correlation necessarily with an infection. So we may see relatively high somatic cell counts that are associated with goats that we did not find an intramammary infection in. So we're going to be doing that as well. Once we finish collecting culture data from our goats that after everybody has their kids, we're going to be evaluating any samples from does that did not cure their infection and doing some genetic testing on those bacterial isolates to determine if there are any antibacterial resistance genes that are developing in the bacteria and trying to determine if that's going to change our recommendations for intramammary dry treatment. We haven't necessarily seen that type of trend clinically in cattle, but I don't know that evaluation has really been carried out on a large scale in cattle either. So this is kind of a novel evaluation in goats and cattle, and I'm pretty excited to see what comes of it. The last portion of this grant and this project that I'm working on is community outreach. So that includes webinars like today. Also, we have a podcast on milk quality in dairy goats that I'm going to give a shameless plug for right now. It's called Baws and Bleats, and it's supported by the American Association of Small Ruminant Practitioners, as well as the USDA grant that funds my research. So if you haven't found that yet, you can pretty much listen to it on any podcast platform. So give it a listen and send us an email. Let me know what you think of it. We also have a website that's going to be coming soon to kind of compile a lot of this information and make it easier for producers and veterinarians to access. So a couple of, excuse me, there are plenty of questions that we're not able to answer with this study. I like to think that this research is just kind of the tip of the iceberg, and it's kind of a jumping off point. So I want to make sure that we're clear on things that we're not going to be able to address with the research that I'm working on getting done. We will not directly be establishing withdrawal times, and we are not getting these products approved for dairy goats. There will not be a label claim saying these are effective in dairy goats. The project is essentially aimed at getting more information so that a third-party group of veterinarians and pharmacologists can make appropriate recommendations for how to use this drug in goats without having to do the full drug approval process, which is incredibly rigorous and intensive. I'm involved with a different project that requires that right now. And that is a lot more intensive study than what we are doing. So just to be clear, this is not to develop a label claim. It's just to help get some more information that is goat specific. We also are looking at trying to determine, or we won't be able to determine the prevalence of subclinical mastitis on goat dairies on a small scale, because we're only doing the study on 2 dairies, one in Wisconsin and one in California. And so those might be accurate representations of every other dairy in the country, but chances are they're not. And there's a large range of sizes of operations. So we could have, small scale producers that have less than 10 animals up to, several thousand animals. So chances of these 2 dairies being an accurate representation of pathogens on every dairy in the United States is very unlikely. We also haven't determined whether coagulase negative staph are environmental or contagious pathogens. And that is definitely a question that I think needs to be answered, because we need to know how our animals are contracting these infections and if they're likely to develop them every single year, regardless of whether they've, were treated for them previously during the dry period, or if this is something that we can actually aim to eliminate as a pathogen on goat dairies. And so it's just, something that we still need to dig into a bit more. We also are not evaluating the efficacy of these products on pathogens other than coag negative staph. So we're not looking at Staph aureus or anything else. So something to remember when these papers finally get published. We also aren't looking at repeated use of dry therapy and its contribution to antimicrobial resistance. This study is only spanning 1 lactation. So we're only going to be looking at 1 episode of dry treatment and the genes that could be turned on for antimicrobial resistance. But we would need to do a much longer study to evaluate how, if there are compounded effects over time of that type of antimicrobial use. Also, there could be some breed-related resistance to intramammary infection that could alter our subclinical prevalence. There are several other dry cow products, antimicrobials, that are not approved in dairy goats that we could look into as well. We just don't have the time or the goats to do it right now. And then the effects of subclinical mastitis on goat milk and goat cheese products. We have a general idea that healthy udders, like I said, make better quality products, but getting a better idea of what that relationship looks like is something, a project for another time. So just want to set expectations and make sure that, we understand that we can't do everything, answer every question with 1 project. And from what I'm learning in grad school, most research leads to more research. So, okay, so you don't have to make me feel good. If you're not actually interested in implementing some type of screening on your animals, please answer no and be honest. But I'm just curious how much new information we were able to present today and if that might affect on-farm decision-making. So looking at screening tools and starting to use those after this webinar, and then also gauging whether folks might be interested in implementing antimicrobial testing. So testing that milk before it goes into the bulk tank, now that it's on your radar, and we've kind of talked about it a little bit today.
Well, it looks like most of the people that were going to participate have, so I've shared the results, and it looks like you got a good response to the presentation here today, Michelle. Looks like you got about close to 90%, 80% that are going to implement some type of screening and implementing some testing on farm. So that's great.
Awesome. Well, I guess I'm very convincing. My mom always told me I should go into sales. This is really interesting though and encouraging. So thank you guys for participating and for tuning in today.
Michelle, looks like there's a couple questions that are in the chat box, and I can read through those if you don't see those there on your screen there. But one is, what would be a good somatic cell count target for the herd on the bulk milk tank?
That is a very individual farm answer. Unfortunately, I feel like I've been saying that a lot, but so we can't be over 1 million for grade A milk, right? So we can't be over 1 million somatic cell count. However, you know, how low can you go is really the name of the game, because the higher quality your milk, the better the product your produce or your excuse me, depending on if you're shipping milk commercially or not. Some milk processors offer bonuses for lower somatic cell counts and higher components and things like that. So I would say definitely under 1 million. If you have a processor that you're working with, I would talk to them about whether they have a bonus plan in place that might give you some goals. And then, you know, I would say see where you're starting out at, and talk with your veterinarian, or feel free to email us as well if you're looking for ways that you can start evaluating if and how to drop that somatic cell count even lower. But I don't think there's necessarily an industry benchmark at this point, just because we have so many different types of producers out there. So sorry, I can't answer your question with a number. Hopefully that helped. What's the next one, Jen?
Yeah, and you may have alluded to this in your presentation, but does California mastitis test also have the same issues as DHIA? So as does get higher somatic cell counts throughout their lactation or in the autumn, are they more likely to have a positive California mastitis test without an infection being present? And especially if you use it 1 week before drying off. So if you're evaluating that 1 week prior.
That's a great question. And I don't think I addressed it specifically during the presentation, but California mastitis test, like the DHI test, is just going to evaluate somatic cell count. It's not going to tell us if that count is high because of a pathogen. It's not going to tell us what the count was a month ago unless you tested that goat a month ago. So I think in the presentation, I presented it more of like doing this test only before dry off, but really it's ideal to be doing this test throughout the lactation, so that you have an idea of what that animal's score was at another point earlier in their lactation, at several points hopefully, and that you're recording that. And so you can say, oh, well, she was a trace to nothing the last 3 times we tested her, and now she's a 2. This is an animal that we need to be concerned about. So so it's not going to give you pathogen data specifically, but it will allow you to follow trends for pretty minimal cost and minimal labor, and hopefully help you catch some animals that are developing issues. But using it at one time point may not be the most effective way to use it unless you're seeing lots of pretty moderate to severe cases and lots of clumps and agglutination within the assay. Then obviously you're going to be concerned about those animals. But yes, those changes might just be natural changes that are happening over time. If you're seeing, excuse me, lots of like 2s coming up in your herd. So that's a good point. Thank you for bringing that up.
And then there's a third question in the chat. And again, if you have any other questions, feel free to type them in, or you are free to unmute and ask the question as well. So the question I have here is, how early in lactation can you dry off a moderate production dairy goat? For example, if the milk isn't wanted, like a hobby farm, or a goat is unwell, any special techniques?
I think that's something to discuss with your veterinarian. I mean, a lot of these goats are going more than a year in lactation. And so drying them up immediately after milking, probably not going to be very comfortable for that animal. And if you have dairy goats but are wanting to use them for meat, I would say maybe instead of drying them off early, consider, excuse me, getting a meat breed or just allowing them to raise their own kids. Obviously, there are a lot of other potential issues that can come up when we talk about allowing kids to nurse instead of bottle feeding them. Excuse me. I have a podcast episode coming up about pros and cons of bottle feeding versus dam raised kids. So I would direct you to that to learn more about it. But essentially, if you have a health reason to dry a doe up, that's something that your veterinarian should be involved in making that decision with you. Certainly, the goal for dairy animals is to keep them milking as long as possible. So that's the way that their bodies are programmed. And any special cases is going to be a medical decision to make with you and your veterinarian on a case-by-case basis. So hopefully that answers your question.
And it looks like we had one more question, Michelle. This will probably be our final question here as we wrap up the webinar. If you have a doe that you cultured for mastitis in August and treated with Spectromast and ampicillin and are wanting to dry her off now, do you need to retest to make sure she is good, or can you just go ahead and do a dry treatment and be okay? How long is the residual in a dry treatment?
Well, if you were using a lactating tube when you dried her off in August, then that shouldn't have very long residual effects. Ideally, you would need to contact FARAD, or your veterinarian would contact FARAD to give you an appropriate milk withhold for that. I would recommend evaluating that animal before, so probably culture her before treating her with an intramammary antimicrobial, just because, I mean, if you're going to take the time to treat her, I think it's worth making sure that she needs to be treated. If you just have one animal that you're concerned about, it's really not going to be that time consuming or cost intensive to do a follow-up culture on her, since it's been several weeks. And some farms will do follow-up cultures on animals that they've treated routinely on the larger scale production type settings. So my recommendation would be to do a culture before administering treatment, just so that we make sure that we're not using antimicrobials unnecessarily and not, and not harassing that doe with an intramammary tube unnecessarily. We all know how fun that can be as well. So hopefully that's helpful for you.
All right, and we did have one more question. Are you willing to take it? Or?
Sure, yeah.
Okay, all right. And so in the UK, we have a target for cow herds to stay below 25 cases of clinical mastitis per 100 cows yearly. Is there a target for goats in the US? Question, is it likely to be lower?
That's a great question. To my knowledge, we do not have that target for dairy cattle, and certainly not for dairy goats either. So I think that's a great goal to have as far as overall animal health, and that's a great thing that producers can implement on their own. But to my knowledge, we don't have any type of benchmarks like that in the United States currently. But thank you for sharing. And thanks for tuning in from the UK. Wow, that's crazy. All right.
Yeah, so I don't see any other questions, Michelle. I appreciate you being on the webinar here today. It's been great to have you on and share your resources as well as the research that is being done. I think you did a really good job of explaining how the project is progressing and how we're going to be able to use that information in the future. So it's fun to see that advance and how it's going to help the dairy goat industry as well. So any other last comments you want to provide, or?
No, just I'm still learning. I've learned a lot with this project, and so if people have questions or something I said sounds off or it doesn't groove with your experience or your knowledge, please reach out. I learn new things every day, and I certainly don't claim to be an expert, but I'm working on it. So thank you all so much for your time, and yeah, have a great day. Hopefully we'll see you again on one of these soon.